Good morning, everyone. Hopla. And thank you for having me today. Let me just start, because the time is thin, to introduce the first speaker, Antoine Flahault. You can find his impressive biography and professional achievements looking at the website of the Lugano Summer School. And since I have the chance to work closely with him, serving in the directorate of SSPH+, let me share with you a more personal note. A few months ago, Antoine published a book in French entitled Prévenez-moi, Prevent Me, of which he gave me a copy as a gift. Looking forward to the session of today, I could not find a better idea than to take the book with me on holidays. So honestly, I was convinced I would be bored after a few pages, but I wasn't. The literary style is almost that of a novel, which makes the reading much more pleasant than usual technical books. But the goal of the book is not only to spread the gospel of prevention by presenting a synthesis of the available evidence on prevention in an appealing way, because the ultimate goal of public health people is to change behaviors. And we know that a partial change of behavior is much better than no change at all. So, rather than insisting on a series of prohibitions or prescriptions, the kind of assertive discourse that makes sometimes public health experts boring and disliked, Antoine offers the lay readers a series of shades of gray on preventive measures, with an approach that reminded me the nudging of Richard Taylor and Cass Sunstein. When I was at the beach of Minorca, I wasn't prepared to completely avoid tanning. But after reading the chapter on the risk of sun exposure, and I was really on the beach, then at least I decided to upgrade my sun protection from 20 to 50. So this is the kind of slight change that Antoine is looking for through his book. So Antoine, I hope I didn't spoil too much your intervention. You have the floor for the next 15 minutes, and I give a sign when the 2 minutes are left. The floor is yours.
Thank you very much, Luca, for your kind words. Thank you also, Suzanne, for your kind invitation, and good morning, everyone. Unfortunately, I will give a boring conference on prevention. I hope not too much boring, but it will not be a novel, for sure, because you are literate here, and because you have all the skills to maybe try to implement prevention, which will be a very, very great challenge. What I will try to mention today is how prevention is, of course, something which is a challenge for our health, but also for the health of the planet. We are getting older, not only myself and probably not you so quickly, but the world is getting old, and in most part of the world, in less than 30 years, we will see a huge proportion of elderly. So we need to find some solutions for prevention. And I will take the example of a very recent publication in The Lancet, which gives 14 actionable determinants of cognitive disorders. Alzheimer's disease, dementia, is one of the most concerned things people in many surveys showed. But it's not only for that I've chosen this example. It's also because these actionable determinants, for many of them, are also determinants for other diseases, for chronic conditions such as cardiovascular disease or cancer, you will see. The first one, at least in terms of the early life importance of prevention, is about education. You are here practicing prevention against cognitive disorders just by being here. Just looking for a university degree is something which may decrease the risk of cognitive disorders by 4 or 5 times. Hearing loss is not so well known as one of the most actionable determinant against dementia. But many people, most people, have a hearing loss when they are getting older, and they are not corrected for that. So to screen and to correct hearing loss is something of high importance. Of course, we all know that cholesterol, and particularly LDL cholesterol level, is something which is very important for cardiovascular disease, but it is also important for cognitive disorders. And there are ways to lower LDL cholesterol, which are not only medicines and statins. Of course, they work and they work well, and it's useful to prescribe them, but we will see just after that healthy diet, stop smoking, lower our problematic alcohol consumption, and physical activity may play a leading role to decrease LDL cholesterol. Mental disorders are also something which are under the radar because not screened enough, not detected enough, and even when detected, not treated enough. And depression is one of the key determinant of Alzheimer's disease and other dementia. So to treat them, to detect them and to treat them is key. What is not so well known is that head trauma, and particularly repeated head trauma with concussion, is also a risk factor for dementia. It's very important, and for instance, some countries like in the UK or in the USA, they have decided to ban HID during football for the adolescents and junior. They are not allowed to play with head. And there are some discussions among international organizations of football to maybe to change the rules and to ask the ball to at least to go to the floor before hitting. The woman also says the ball itself is the same as for the men, and their muscles are not as strong as men's, particularly in the neck, and so they say they are more at risk with these heads. It's not only football, many games, many sports activities, skis and bicycle needs also some protections, and helmet are of importance. Diabetes, we all know that diabetes is a risk factor for many conditions, and particularly for cardiovascular disease. Diabetes is also a factor for cognitive disorders. If diabetes was a country, it would be the third country in the EU only, just because of the number of Europeans having diabetes. Obesity is increasing in Europe, and obesity itself is also a risk factor for cancer, for cardiovascular disease, for cognitive disorders. High blood pressure, it's so surprising to see in a country like France, who have a universal health coverage, a huge access to doctors and to medicines for very low cost. And most of them, when they experience hypertension, are not detected for that. Even half of them are not detected, you can see, and it does not change with time. And even when they are detected, they are not correctly treated. Only 20 or 30% of them are correctly treated against high blood pressure, when we know that high blood pressure is a key determinant of myocardial infarction, one of the leading causes of death and of disability also, and also of Alzheimer's disease and dementia. It's very, very surprising and disappointing. Sedentarity is something which is key, and I say that we could also give some benefits to the planet, to the health of the planet. It's because when you walk, when you use your bicycle or active mobilities, you are saving carbon footprint, and it's good for the planet and it's good for your life. And probably walking is one of the best options for doubling our healthy life years. Healthy diet is also good for the planet. As Suzanne mentioned, here we are trying to make efforts to decrease our red meat consumption. The red meat consumption is much too much in Europe, particularly, and also in the United States, in Americas. And when you understand that it is 37% of the greenhouse gas emissions and 80% of them only in the livestock, you can imagine that just by reducing, not beginning vegans, but just by reducing at least for 30% or 50% your consumption of red meat, you will save your health and you will also help saving the planet. Smoking tobacco, it's very well known that it is something which is of high importance, but also for dementia. And it's not only a question of behavior and of doctors, I would say. The law and the regulations and taxes are playing a leading role. And when you have some liberal politics, for instance, here in South Africa, which decrease the tax on tobacco, on smoking tobacco, you have immediately an increase in consumption. It's not so well known that in Japan, in the last 7 years, they have decreased their smoking rate of cigarettes by 50%. 50% decrease. It is amazing. And it's not due to public health. It's due to tobacco company. It's a kind of commercial determinant, but a positive one, because they are promoting smokeless tobacco, which is not without any risk, of course, but as Luca mentioned, it decreases the risk because smoking is a major risk. WHO says that because of smoking, half of the smokers will die from their smoking habits. So decreasing is always a good news, even if it is because of tobacco companies. Alcohol is also a risk factor. I'm not sure we will follow the Swedish model in Switzerland, but in Switzerland we have a 30%, we are above the Swedish consumption by 30% of alcohol consumption. So to make some progress is key. The Swedish system is deprivatization of alcohol sales. So you can buy your alcohol only in the system Bolaget, which is a public system. You are not allowed to buy alcohol in supermarket, like in Migros, but you know that Migros has bought another chain which sells alcohol. So it's not like that. Maybe we could be closer to the Italian model. The Italian model is amazing. They have decreased their consumption of alcohol, and they are now very close to the Swedish level. And they do not forbid alcohol sales in supermarket. They promote alcohol-free beverages. I'm not marketing alcohol beverage in this slide. All these bottles are alcohol-free and sugar-free too. So you have, of course, beer without alcohol, but you have also spirits without alcohol, and to promote that, at least, decrease your alcohol consumption. Social isolation is something which is probably difficult to address with public policies, how to increase social contacts. The Japanese tradition, so it's not a policy, it's really more a tradition, has promoted moai. Moai are these mutual aid groups where you belong to several moais when you are Japanese because of your activities, your patience, you are a fan of football, you are a fan of, I don't know, Vermeer, and you do some safaris and you play with your mates and you keep these social links, which is very important, and it has been proven to be protective for dementia. Air pollution is very well known to tap on our life expectancy. It was not so well known that because of air pollution, you increase the risk of dementia. And since air pollution, particularly due to fossil fuels, have increased in many countries, there is a risk that this will translate in an increase in dementia in the future. And also there is a social gradient with air pollution. When you are deprived, when you are in the lower segments of the social segments of the populations, you are more exposed to air pollution. There are also a lot of co-benefits in fighting against air pollution because they are also due to fossil fuel use. So the less you use them, the best for the planet. And you will have to see that. The last one is a visual loss. It's not so well known that visual loss, when it is not corrected, is something which also decreases your social interactions, and it is something which will lead to dementia. The last point I want to mention, which is a bit counterintuitive, is with prevention, we will not increase the life expectancy. It's not the goal of prevention. The goal of prevention is to increase the number of healthy life years within our life expectancy. So we will compress morbidity with less cure for seniors. We will compress morbidity, and then we will be economically an investment. We will be with prevention and investment because also of more autonomy, lower use of caregivers, of institutionalizations, higher participation of the seniors in society, and sometimes even cumulating their job to pension. Higher economic impact of senior lives because they will spend their money because they are healthy for business activities, for culture, for tourism. And so, in fact, you have, because of that, a lot of interest, not only for the planet, not only for health, but also for the economic. So prevention provides us with longer healthy life years. It protects the climate and the planet for many, many things we are doing for prevention. And it saves our healthcare expenditure and also the shortage of healthcare workers. If we are without morbidity for a longer time, we will not need cure, we will not need healthcare workers to take care of us. And you can see in this last figure that prevention is not only a question and a matter of doctors, but also of environmental specialists, but also of social and cultural context specialists, and also of change in behaviors. So thank you very much for your attention.